As the lockdown norms are being relaxed, I think it is time for people who are working from home to get to the field. This is very true for all the pharmaceutical industry colleagues of ours. I firstly thank them for giving me support during this time, and I also would like to give some suggestions for their journey further. First and foremost, keep yourself updated by watching the news, the ICMR guidelines or the Arogya Setu app to find out which zone you belong to. A high risk zone, a normal zone, or a green zone, or a containment zone. Not only where you belong to, but where you intend to go to work, which zone does that area belong to is very, very important. Before leaving for office or the field work, make sure that you yourself are healthy. If you are showing any signs and symptoms, please do not start. Make sure where you are or where you are going to is not a hotspot. Carry your own food and also water. Masks and sanitizers are the rule. Do not forget your ID card. Very important to show to people that you are an essential service now and definitely you need to be allowed. Secondly, when you are working, again, make sure the zone is okay to go. Maintain social distancing. If it's not just 1 meter, it is better to maintain 2 meters because you are also getting into high risk zones of meeting doctors at clinics or the hospitals or medical shops or the retailers. Always wear the mask. Avoid public transport as far as possible. Even if you are taking your own vehicle, if it is two-wheeler, it is better not to keep a pillion. Or if it is a four-wheeler, better not to have more than 2 people in the car. Avoid high-risk areas because you will not only yourself to contract the illness, but you are also intending to get into the place where the doctors are much stressed up. The high-risk area means people possibly are treating COVID-like cases or COVID-positive cases themselves. And if there are 2 or more people, maybe from the same company or the different company, make sure you look at each other, be supportive, look at each other with a concerned eye and suggest something if they are not doing right, like not washing or not maintaining appropriate distance or not keeping the mask fully closed. So please tell them politely. That will be of much use. Calling the doctors is a major job what you have, as I understand. So firstly, what I would like to tell is, please make sure the doctor also is willing to meet you. The doctor is not overstressed. If someone is treating high-risk cases or if they're in the ICUs or they're overburdened with the work, again you presenting that to them may not be looked out as a good thing. So kindly communicate to them in the form of SMS or WhatsApp. Take an appointment time and then only meet. Avoid crowding at the time. I'm sure the doctors also will stagger it, but I'm sure you should also know that some bigger hospitals or big diagnostic centers may not allow medical representatives. So then we might try and meet them in the parking lot or just before they enter their clinics, of course with prior permission of the doctor. Interaction with the hospital staff other than the doctors, like diabetes educators, nurses, especially is required for people who deal with insulin and other gadgets like glucometers. Try and avoid as much as possible. I'm sure you all have good videos made by your companies about how to use your gadgets. Kindly pass it on to the healthcare professionals or the patients. They would appreciate it. If they still can't figure it out, you can help them by video calls. If they still can't, then I'm sure you can visit to them with all necessary precautions. Keep all those meetings, as we are all doing lovely, by the way of webinars or virtual meetings, of course with prior consents. Once you finish the work, call up home and tell them that you are coming and let them keep a freeway to the bathroom. So as you approach the house, what I would suggest is keep your shoes in the ground floor or in a separate area distant. Wash your hands and legs with soap and water. Come to the main door. Keep a small box where you can keep some essentials which you have carried, which we don't want to carry it in, like keys and other stuffs. Put it near the door and leave it out and then get in. Even the mobile can be left outside. Glasses I usually leave it outside. Spray them with sanitizers. Wash them and keep it dry. Get into the bathroom. Wash everything with soap and hot water. and then get out. As you get out, try to maintain as much distance as possible with your household people also, and continue to follow the 5 commandments as we always deal with it. The first of the commandment is with respect to the apps. Download the app, follow the Government of India or ICMR updated guidelines. Second is 3 C's. Clean, wash hands, clean the premises, cover your cough and sneeze. Now the cover also applies to the mask. Contain means if you have any minor symptoms, please stay at home. If the symptoms are not improving, get back to one of us. And the 5th one is distancing, at least 1 meter, preferably 2 meters. So stay healthy and let us all together defeat this pandemic. Thank you very much for patient listening.